Well, hey, thanks so much, Serge. So, yesterday I had the opportunity to keynote the HIMSS conference with 24,000 people. And you know that I did not use the words AI in my slides at all. I was asked very similarly to the discussion today to take a look at network effects and how that is affecting healthcare today, but how it will affect healthcare tomorrow. I've been in 21 countries in the last 6 months, and I would tell you it is not country specific that healthcare today is late stage. Diagnoses are often missed. Interventions are often painful and expensive. It's hard to navigate. And certainly, you don't always get the best care because, in fact, it's geographically dependent upon are you urban, are you rural? Who is the person you're seeing and what is their experience? I think all of us want to change that. To give you a context, so I went to medical school in the 1980s. And what does that mean? About 60% of what I know is wrong. In my life as an emergency physician, I'll see about 10,000 patients. And so, in fact, my data set is going to be limited to those 10,000. Have I ever diagnosed Lou Gehrig's disease, ALS? Will I ever see a patient with ALS? Probably not. So, what Mayo has done is recognize that for a network effect, you need to curate the world's data, convene the world's solution developers, the innovators, and disseminate those innovations very rapidly. You may know from Clay Christensen that the average time to innovate in healthcare is 20 years. And the question is, can you take that from 20 years to 20 hours? Here is our approach. We took Mayo Clinic's data, it's 150 years, 10 million patients. We recognize that across the world, there are different regulatory frameworks, whether that's HIPAA, GDPR, Brazilian privacy law, Israeli privacy law. Can you de-identify data in a way that is going to work across all cultures? We did this with structured data, problems, meds, allergies. We did it with the unstructured data, the notes. Very hard to do with notes because you have to remove job role, geography, familial relationships. We did it with images. We had to modify them so you couldn't reconstruct a face. We did it with genomes. We did it with telemetry. The end result was 50 petabytes of multimodal, de-identified data for solution developers in a cloud development environment to create novel, predictive, generative, and agentic systems. And then we started to spread it to the world. We went to Mercy Health, 15 million. We went to Albert Einstein, Brazil. And then we went to UHN Canada, Seoul National, South Korea, Israel, and beyond. End result is today, we're able to develop models or do unique visualizations on more than 50 million birth to death multimodal records. What does that do for you? And why is this going to be a new standard of care into the future? I'm almost 64. I care about the accuracy of colonoscopy. Do you know that the best endoscopist will miss 15% of small lesions? But an AI model augmenting an endoscopist will miss 3%. Should not it be the standard of care that every colonoscopy done anywhere in the world is AI augmented using models that have been collaboratively developed across multiple cultures and multiple data sets? Similarly, diagnoses of various heart conditions can be done now from devices you wear or consumer grade devices you buy on Amazon. Mayo has 14 algorithms for that. And radiation oncology, very, very complex to program a linear accelerator to deliver radiation to a tumor without affecting the surrounding tissue. It takes a complex array of specialists, 16 hours to do head and neck tumors. A foundation model can do it in moments with the same quality and accuracy. So I tell you this, that together we will work on curating the world's historical data so the patients of the future will get the very best experience of the best specialists, regardless of their location, with quality and accuracy that could not be achieved by a human alone, and timeliness of data that is up to the moment, not medical school training in the 1980s. So I will tell you, having done this for 40 years, it's the very best time in history to be part of healthcare innovation.